Let me ask you this question. Can laughter really speed up the healing process in therapy? Hey everyone. Welcome to the channel. Today, we're diving into a question that might seem a little unexpected in the world of therapy. Can laughter actually speed up the healing process? We all know that therapy is a place to dig deep into our emotions and work through tough issues, but what if laughter could play a key role in that journey? Could a little humor, joy, and lightheartedness actually make a real difference in how we heal? That's what I'm exploring today, whether laughter is just a fun distraction or if it's a true healing tool. Stay tuned, because I think you might be surprised by what we find out. Laughter and mental health. The first look, laughter is one of those emotions we all experience. It's often seen as a sign of happiness, a way to bond with others, and a way to relieve stress. Think about it. After a good laugh, doesn't everything feel a little lighter, a little easier? But what if I told you that laughter isn't just a temporary mood booster? It could actually play a vital role in helping us heal, especially in a therapeutic setting? Personally, I've always thought of laughter as a way to lighten the load. Whenever I'm feeling stressed or anxious, a good laugh can make me feel like a weight has been lifted, if only for a moment. But can something so simple, something so joyful, actually affect our mental health in a meaningful way? That's the question I want to explore with you today. The misconception. Laughter as a distraction. Now, before we get into the science, I know some of you might be thinking, wait a second, isn't laughter just a distraction? Isn't therapy supposed to be serious work? I totally get where you're coming from. It's easy to think of laughter as a surface-level emotion, something that keeps us from facing the real issues. But what if this very thing we dismiss as trivial could actually be the key to unlocking deeper healing? It's natural to think of therapy as a solemn, serious space where we confront our pain, work through our struggles, and reflect deeply on our emotions. We've been conditioned to believe that real healing only happens when we're focused on sadness, anger, or fear. But what if we're missing an important part of the healing process by not incorporating joy, connection, and yes, laughter? I think it's time to challenge this assumption that therapy needs to be all about heavy emotions and intense introspection. What if laughter could actually be part of the process, not as a distraction, but as a catalyst for change? Why laughter matters. The science here's where it gets interesting. Research shows that laughter does more than just make us feel good for a few minutes. It actually has profound effects on both our mental and physical health. So, let's dive into some science. First off, laughter stimulates the release of endorphins, which are often called the feel-good hormones. These are the same chemicals responsible for that high we get when we exercise or engage in something that excites us. Endorphins can lift our mood and even create a sense of euphoria. But that's just the tip of the iceberg. Laughter has also been shown to reduce cortisol, the stress hormone that's linked to anxiety and depression. When cortisol levels drop, we feel more relaxed, less stressed, and more capable of facing challenges with a clearer mind. And let's not forget about oxytocin, the love hormone. It's released when we connect with others, and it's vital for building trust and creating a sense of emotional safety. This is why laughing with others, whether with friends, family, or even in therapy, can help us feel more bonded, supported, and less isolated in our struggles. But there's more. Laughter also boosts the immune system, increases blood flow to the brain, and can even reduce pain. Yes, you heard that right. Laughter can literally make us feel less physical pain. So, next time you're feeling down or in pain, maybe consider cracking a joke or watching a funny video. Laughter in therapy. Real-world applications now. Let's talk about how laughter is actually used in therapy. While it may sound like a new age concept, laughter in therapy has been around for decades. One of the most well-known examples is the work of Patch Adams, a doctor who used humor to help his patients heal. Patch believed that laughter was not just a way to cope with illness, it was a way to treat it. His work is still a model for humor therapy today, and it shows us that laughter is not just a nice to have in therapy, it's a powerful healing tool. In addition to humor therapy, there's also laughter yoga, a practice that combines laughter with deep breathing and stretching exercises. It's designed to release tension, boost mood, and even improve mental clarity. It's not just about laughing for the sake of it, it's about using laughter to unlock deeper emotional and physical benefits. And in regular therapy sessions, therapists have found that introducing moments of humor, whether through light jokes, playful interactions, or just finding the humor in difficult situations, can create a sense of comfort and safety. It helps clients relax, open up, and feel more at ease in the healing process. Personal story. The power of humor in therapy. Let me share a personal story with you to bring this all to life. I had a close friend who was struggling with anxiety and depression for a long time. She'd been seeing a therapist for months, but she felt like she wasn't making much progress. Sessions felt heavy, almost exhausting, and there were days when she left feeling worse than when she came in. But then something changed. Her therapist started introducing a little humor into their sessions. At first, it was just small moments, light jokes about the challenges she was facing, or humorous perspectives on difficult situations. Slowly, the atmosphere in the room shifted. Instead of feeling like she was always digging into her pain, she started feeling like she could breathe again. She found herself laughing at some of the things that had previously seemed overwhelming. And with that laughter came a new sense of perspective and release. The therapy sessions became more productive, and she started to feel hopeful about her progress again. So, what have we learned today? Laughter isn't just a way to avoid tough emotions, it's a powerful tool in the therapeutic process. It can change the way we engage with our emotions, help us reframe challenges, and even heal us in ways we didn't expect. Laughter doesn't replace the need for deep emotional work, but it can make that work feel more manageable, more human, and even more effective. It's about finding the balance between facing our pain and also giving ourselves permission to experience joy, connection, and relief. Here's my challenge to you. Next time you're in therapy, or even just having a conversation with a friend or loved one, try to bring some laughter into the mix. Don't force it, of course, but notice how humor and lightness might shift the energy in the room. See how it impacts the conversation and your ability to process difficult emotions. And if you've ever experienced laughter in therapy or have a story about humor helping you heal, I want to hear it. Share your story in the comments below, and let's keep the conversation going. Thank you so much for watching. Don't forget to check out my other videos on mental health topics. I've got tons of valuable content coming your way. Until next time, take care and keep laughing.